Let me connect the video to check.
Okay, we can start.
Let me connect the video to check.
Okay, we can start.
I can start? Good afternoon, Dr. Deepa Ganesh. My name is Fahima Mubarak, and I am a second-year medical student at Mada Medical College and Research Institute. I am both very grateful and deeply honored to get to interview you today. Thank you so much for taking the time out of your schedule and doing this for us. It means so much. My name is Fahima Mubarak, and I am a second-year medical student at Mada Medical College and Research Institute. I am both very grateful and deeply honored to get to interview you today. Thank you so much for taking the time out of your schedule and doing this for us. It means so much. My name is Fahima Mubarak, and I am a second-year medical student at Mada Medical College and Research Institute. I am both very grateful and deeply honored to get to interview you today. Thank you. A quick introduction about our guest of honor. Dr. Deepa Ganesh completed her MBBS as well as her master's in obstetrics and gynecology at the revered Sri Ramachandra Medical College. After this, she went on to make an excellent reputation for herself in the fields of minimal access surgery, minimal invasive surgery, advanced laparoscopic surgery, and even cosmetic gynecology. Yes, as well as the years, she's done service in several countries apart from India, including but not limited to USA, France, and Germany. She has been trained intensively in laparoscopic gynecological cancer surgeries and holds a diploma from the IRCAD University of France. So, thank you so much for being here, ma'am. It's an absolute honor.
My pleasure, Ma. It's really nice to see all the young ones actually conducting such a programs, especially on a topic still a taboo and nobody really talks about it. And I'm really happy to see all the young generation coming out and the future dynamic aspiring practitioners. So it's really honor to be here. So I think we can go ahead and start the session.
Yes, ma'am. Thank you so much. So, since the topic of today's discussion is sexual hygiene and it is of paramount importance in today's society, what are your views on the topic, ma'am? Do you think there is an adequate amount of education regarding this in today's society?
Yeah, as I said, no, started still a taboo topic. Nobody talks about it. First of all, I think the awareness has to be created among the doctors because when the patient comes, they don't open up immediately. They'll come, they hesitate, they may beat around the bush. A lot of times, most of the practitioners, what they do because of the busy schedule, like, no, they just, okay, what's your complaint? And then, like, no, very fast, they just want to, like, no, give the treatment, send them off. But I think that shouldn't be there, like, no, especially these kind of taboo topics, because it's very important. I mean, starting with a sexual hygiene or intimate hygiene, because day to day we'll see all these infections, and one of the commonest problem women do come to visit a general practitioner or the gynecologist. So I think we need to spend some time and actually we should open up and we should be open about it, not be like, no, okay, fine, like, because I've seen most of the doctors like, okay, fine, nothing, it's all normal, you can just so even if they're coming forward to open up, they like just shut themselves and they'll just go off. So I think, like, this is a must. So usually I say in all my even interviews and like, even conference talks, I think it's a part of history taking itself. This should come in because the patient don't open up, especially when if it's a big, let it be single or the married couples, when they have all these issues, they don't open up. So the part of history taking, I think when we actually put forward the questions and then they'll actually open up, because I've seen a lot of patients who will have these problems, but when they come to me, they don't say. They'll be beating around the bush. They'll be saying, I'm just feeling so weak and so tired. I'm having headache. What do I do? So that will be the complaint. So most of the times we give general, like whatever test or multivitamins. Then again, they'll go out after 10 minutes. Again, they'll come in. No, this is not the issue we have come. Again, they'll be like 10 minutes. They'll be sitting in the room and, So I think once we start asking them questions, it will be easy for them to open up. So I think once we do that, and this generation, I'm seeing a lot of people are actually little because of the exposures, like internet and Google, everything. Everybody's got all the informations there. So I mean, a lot of young girls come and open up and talk directly about it, but some still very conservative and like they don't talk. I think we should actually be open and we should go ahead with it.
How do you think we can start inculcating these practices into everyday life, ma'am? Like, how do we make this more normalized?
I didn't get you. What was that?
How do we start inculcating these practices to make this discussions about this topic more normalized?
You're talking about general public or when they come to us to the medical practice?
General public, ma'am.
In general, I'm just saying, no, like first thing, what I tell all publishers, like we the Google, and most of the time they tend to read that, they just go by it, they don't get a proper medical advice if it's right or wrong, especially when it comes to their private hygiene or intimate hygiene. A lot of times, as I said, no, nowadays the trend is like a lot of people are watching YouTube videos, and a lot of people, even starting from the young girls to the older ones, are giving a lot of advices, and people literally take that and start doing it and finally end up with a lot of complications, and they come to me. So the first thing I would say is like, you can see all these information, but anything always like, have a family physician or a family gynecologist, always consult them, ask them whether is it right to take such a medications or can I do these? Because a lot of times they hygienic like wash, they start like washing with Dettol, Savlon, they add some vinegar in the water because they have some false smelling discharge or some kind of itching, they apply curd, and if it's really dark they apply turmeric and curd, all kind of like whatever we do it on the face packs, same thing they start applying in the intimate areas, and then they come with the complications because infections are like really I'm seeing a lot of rise, especially in the intimate hygiene, and a lot of sexually transmitted infections where they don't treat it in the early that actually keeps getting worse. So the first thing I would say for the public is like, I know a lot of informations are there, but always consult your doctor, trust your doctor, consult your doctor and get the proper advice saying whether is it right or wrong, whether I can continue or not.
Thank you so much for that answer, ma'am. That was very beautifully put. Thank you so much. One of the other topics that has been gaining a lot of popularity recently is menstrual cups. Despite how popular it is becoming, though, there is a lot of apprehension surrounding it. How do we use it? How do we remove it? How do we clean it? How do we? Is it better for us? Is it safe? Is it healthy? Ma'am, could you please shed some light on this issue?
Yeah, see, again, coming to the menstrual hygiene, that is also very, very important. A lot of people are not having a knowledge. See, whatever it may be, but usually people are being, gone are those days where people are using cloth now because of little and all the sanitary, sanitation, everything. People have started using now sanitary napkins and pads. That was a calmness which people are using. Then later came tampons. Tampons, another one. It's like a compressed, like a napkin where you insert inside and then it'll actually absorb the blood, just like a napkin, what it does. And the third one, which is little, as you said, becoming a little popular, is a menstrual cup. See, these three are like, it's that personal choice. That's what I would say. But again, if it's going to be a sanitary pad or the tampons, every 4 to 6 hours, they have to change. Even like, for some, depends upon how much of flow they have. If it's really excessive flow, then they tend to change every 2 or 3 hours. Otherwise, 4 to 6 hours, you have to change. Whereas menstrual cup, see, those two are disposable. Sanitary pads as well as tampons, never dispose it properly. Whereas menstrual cup, it's a reusable cup. It's actually medical grade silicone plastic cup where it is like, it's very safe. It can be inserted into the vagina, and a different techniques. You have C technique and U technique. That proper, you have to insert into the vagina. And initially they'll have difficulty in inserting because they should know the proper method. Otherwise they can cause tear or lacerations in the vagina that can cause a bleeding. Once properly, like, either they can go to a gynecologist and then ask them, like, how do I insert it? And it comes in different sizes, small, medium, and large. So again, like, for the younger one, like, you can go with a smaller medium, and post delivery. And if they have 2, 3 delivery, vaginal deliveries, then obviously then you have to go for the larger cup. That has to be inserted. And the menstrual cup is basically, it collects the blood. So, and it can stay up to 8 to 12 hours. So you can change up to 8 or maximum 12 hours, but not more than that. And every time you have to take the cup out, you have to dispose the blood, wash it properly, and then reinsert. The only issue you will have in the menstrual cup is the sterility and the hygienic thing. Most of the time, they don't clean it properly and they don't reinsert it. That's the reason a lot of times you get vaginal infections are more common in menstrual cups. And again, we are in like an office or a public restrooms, again that becomes issue, because you have to come to the sink, you have to dispose the blood, clean it up, so you have to see the environment also, it is properly clean. And again, reinserting, it has to be properly hygienically, it has to be reinserted. So that's one little advantage, is the reusable. So there are cups which comes for like 5 years and even 10 years, that it can be reusable. And once your cycle is over, again, you have to properly sterile it, wash it sterile in hot water, clean it, and then put it in a pouch and keep it. Every time whenever you use that, you have to make sure, like, again, like, it's properly cleaned, and with hot water, with sterility, it has to be inserted. Otherwise, infection, it's a main concern in that. Of all these three, like, I usually, when the patients come and ask, I just tell them it's your personal choice, whichever is comfortable, you can use it. But again, when it comes to a younger girl who's just like till puberty and adolescent, I usually don't prefer telling them to use tampons or menstrual cups, because why? Like, it's just developing. All the internal organs are developing. So sometimes when they don't like insert properly, it can, as I said, it can lead to some tears and like lacerations. So usually I don't do that. And another important concern when it comes to tampons and menstrual cup is, like, still the religious belief is that, hymen has to be there. So, but on and on, I keep saying, like, hymen is not a sign of virginity, but again, there are a lot of factors are there where it can get torn. But still, medically, we can just tell them what is actually significance of hymen. It was just a protective layer around the vagina, just to make sure any other contamination doesn't move in. That was the theory behind the hymen. Then again, the medically, but again, we can go ahead and like, change all the social, religious, and cultural beliefs, so that, like, if patients come and ask, maybe we can just tell them it can be broken while inserting a tampon or menstrual cup. If they're okay with it, it's fine, because even I had a lot of young girls coming and saying, I'm so like comfortable with tampons, I'm so comfortable with menstrual cup, and I really don't bother about the hymen, then it's okay. But when they come to us, when we ask, I think it's like we just have to put a word, because later also I've seen young girls coming and saying, like, I've been using tampons for so many years, now I'm getting married, I want my hymen to be reconstructed, they come to me for hymenoplasties. So I think, like, this is initially when they come and ask, like, we can just create an awareness of all the three, what are the pros and cons. If they still want to go ahead, let them go ahead with it. And of all the three, I would say, like, menstrual cup, again, like, if they use it with nicely, medically, and then they can go ahead. And again, it has to be very comfortable for them. Initially it will be a little discomfort, they feel that. And I think properly you have to remove it, because even I had a couple of patients where they weren't able to remove it, they had to come in and I had to remove the cup. So even that also happens. So as long as they're comfortable, yes, they can go ahead and use it.
Thank you so much, ma'am. Do you think it is possible that menstrual cups will overtake the use of pads and tampons? Do you think that's a possibility in the near future?
Can, because of because those two has to be disposed, and because of the environmental everything, I think there are chances. But again, this will be the only concern, because later, as a doctor, we should not be seeing a rise. Already we have a lot of, like, vaginal infections are one of the most commonest day-to-day practices we are seeing. And especially, like, cervical cancer is number one cancer in India among the women. All these starts with all these simple vaginal infections, and it keeps going in. So this is one thing which I think, like, we should not be seeing a rise. and with sterility, I maybe generation, but again, how they would really clean it up and then it inside. That is it.
Thank you, Nan. Since we've arrived at the topic, I've actually been meaning to ask you. It's a known fact that unhygienic sexual activity can cause a lot of infections. Some are very well known, like HIV and gonorrhea. What are the other more common ones that we see in day to day practice, ma'am, and how do we prevent them?
See, simple, all starts with simple personal hygiene. So the commonest mistake what a lot of young women they do is they keep washing that area several times a day. See, when you take a shower once a day, wash with the plain water, and you use a very nice non-scent soap, and you take a little bit nicely lather and use it, and maybe whatever soap or even gel, whatever they use it, they can do with it. After that, immediately to dry that area and wear a loose and undergarments, not a tight-fitting ones. And after that, every time when they go to the restroom, just the plain water or just a tissue is fine. But a lot of time, what I see is every time when they go to the restroom, they keep washing not be there because the pH level, the vaginal pH level has to be maintained between 3.8 to 4.5 because that's when it keeps it acidic and the good bacteria, the lactobacillus, which is plenty in the vagina, next apart from the gut, it actually doesn't allow the other bacteria or fungal or viral infection to come in. So that pH has to be maintained. If there's any disturbance or if it's altered, that's when all these bacterial, fungal, and viral infection comes. That's a main basic that they have to maintain. Well, first commonest complaint when this is altered, what they'll have is bacterial vaginosis. That's when they get this foul smelling discharge or excessive grayish discharge they'll have. That's the first thing they'll note when they keep washing that area excessively, and that disturbs the pH and the lactobacillus decreases, and then these infections sets in. And once this sets in, then other infections will start coming in, like another fungal. Second one is the commonest is the fungal infections. Then again, other parasitic infections like trichomoniasis, as you said, once these comes in, this again, it's a high risk for the sexually transmitted infections later, like HIV, you said chlamydia, and then gonorrhea. And of late, I'm seeing a lot of herpes. Herpes is becoming very common, and of all, that is most commonly I'm just seeing. And even for young girls, most of the people are coming with these kind of infections. So I think first we have to tell them the personal hygiene, how it has to be maintained. What I said is how they have to clean the intimate areas. And now a lot of people keep wearing leggings and jeans. Okay, you can wear it, but not like prolonged time. After some time, you have to change it. That is because the area is always airtight. Again, it will attract the fungal infections because that area is always moist. That is again very important. The third thing is again when you're working out from a yoga or gym, once they come back home, they have to take a shower and then keep the area dry. And again, traveling, you're traveling in a car or a flight or in a train for a long period of time. I would say always go with the loose cotton dresses, maybe a parallel pants or plazo, but not jeans or leggings, because again, it will be very airtight and then again, that can attract infection. Because the first thing they'll notice is after prolonged hours of travel, when they remove their clothes, the first thing is that fishy odor will come. That's bacterial vaginosis will first set up because if the area is airtight. The second, then again, the scabier infections can come, that is fungal infections. That is very important. And another thing is, again, coming back to both the partners, sexual hygiene, yes. If one partner has infection, it's always you treat the other partner. Both has to be treated as infection. A lot of times, just the women come and the partners are not treated. Then she keeps coming recurrently. Every 2 weeks or every month, she comes with the same infection. When I ask, I'm taking the medication, my husband or partner, because they'll be contracting when women comes infection intercourse start also, maybe initially for a few days or few weeks, use a condom so that full infection goes in. That is very important. And another one is, again, before engaging into sexual activity, before and after, make sure they have to empty the bladder. Because commonest you will see is urinary tract infection, because the female urethra is so close to the vagina, and any kind of infection, immediately they'll have a urinary tract infection, especially the young couples, immediately married couples. Immediately you just get a call, like, after marriage, they're saying, I'm having a severe, burning sensation, like severe pain, I'm having blood. That is honeymoon cystitis. Immediately after like the wedding, that is the most common complaints all these young couples will come. So for them, again, tell them drink a lot of water, always empty before and after. And again, after sexual intercourse, just put the plain water and keep that area dry. So these are the like main intimate hygiene which they have to maintain. So I think with all these, I think definitely you can prevent a lot of infections. And if they see any kind of change, see, normal discharge, women will have a normal discharge every day, because basically the vagina is a self-cleansing mechanism. It will self-cleanse itself, and some kind of little watery discharge will come out every day. That is absolutely fine. Again, depends upon which phase of your menstrual cycle. That is, before periods, you'll have a thick, little brownish discharge. That is the period is going to come because both the hormones have come down. Then again, the first phase, the estrogen phase, you'll have little kind of a discharge you'll have, thick discharge. And again, during ovulation, around ovulation time, again, thick white mucus discharge, maybe a little blood tinged or a brownish one. That means your egg ovulation has happened, egg is released. Then the second phase, the progesterone phase, they'll have watery discharge. And again, when the period starts, they'll have a thick mucus. So these are the normal discharges they'll have every day. But when they feel some difference, like when the discharge is becoming very excessive, it's becoming dirty white or greenish or yellowish discharge, or with the foul smelling or excessive itching, then immediately they have to ask the family physician or doctor to see what kind of infection. It could be parasitic, it could be viral, it could be bacterial infection, fungal infection, whatever it is necessary, they have to take a course and make sure both the partner takes a course at the same time. Most of the time, they don't tend to come, but the thing is, they keep getting it recurrently, and that's when it goes to a chronic condition and start affecting the internal organs also. So that is also very important. So any changes, this again, we have to tell them, don't self-medicate, don't use some kind of self-cleansing, by just seeing the internet or some YouTube videos, whatever it is, you just consult and get a proper medicated washes which your gynecologist or your physician will be prescribing. Yes.
Thank you, ma'am. That was very informative. I learned a lot just from that one answer alone, especially. This actually brings me to my next question. There are a lot of new products and fads emerging saying that you need this and you need that, you absolutely need this and stuff. But are these things really necessary, and which of these should we be making use of?
That's why I said, no, whatever it is, don't just go buy whatever it's out there on the internet or the YouTube. Whatever it is, always consult, because like I usually say, intimate areas is a very, very sensitive area. Not for everybody it will be the same. For some, it will really immediately will cause some allergic reactions, and they'll come with a lot of itching, and then you can see all this darkening, everything will happen. So always whichever you see some product, always is no harm, like just consulting a doctor and ask whether I can go ahead and with it. Another commonest thing what I'm seeing is all people start using creams, let it be a shaving cream or hair removing cream. There are different products available, and also there are a lot of gels and creams saying, okay, fine, you can whiten your vagina, intimate areas, inner thighs. So whatever is available on the internet, they'll start buying it and they'll apply it. We don't know what kind of ingredients is there. I usually say, as I said, intimate areas are very, very sensitive. And even if you're going with hair removal creams, little bit you take and apply on the upper part of the mons to see for half an hour. You just do a test dose. Just apply the cream for half an hour. You wait and see if you're having any itching, burning, or redness. If that is fine, then you can go ahead with it. Then any period of time, if you see any kind of reactions, immediately you stop, because that later can cause a severe skin reactions, and it leads a permanent damage where the skin becomes very dark. And a lot of young girls also I'm seeing coming and saying, my vagina is very dark. can I lighten it now? So they come for all the peels and laser treatments for that. So when you ask the history, they say, I used to apply this cream, I used to apply the whitening cream. And over a period of time, what happens? That becomes the teeth that are very dark. So that is also very important. And all the gels and creams, again, like without consulting, I wouldn't say, because it's very, very, very sensitive. Again, like other products, like, lots I'm seeing all these creams and gels for vaginal tightening. Again, like, no, everything they just insert it to the vagina and they just apply all those. Then again, over a period of time, it can cause a lot of reactions. Maybe immediately it will not be seen. Maybe after a few years, then again, I'll come with a nice vaginal erosions or cervical erosions. That's when it leads to chronic cervicitis, and later stage, it can even lead to cervical cancer. It's not only that, now for the younger generation, it again, the infection can go in and it can affect. See, one of the commonest I said is cervical cancer, which is number one cancer among the reproductive system in women in India. And then if when infection starts spreading inside the endometrium, it causes endometritis. So if the young people are trying for pregnancy, endometrium is the lining where the embryo gets go and gets implanted. So there's infection, again, implantation will not occur and they'll have issues in pregnancy. See, again, infection, 25 to 30%, it's becoming a cause of infertility now. Infertility is really rising, and infection is becoming one of the major issues now. Endometriosis can happen. Then again, it can spread upwards and it can affect both the fallopian tubes, and the fallopian tubes can become blocked. One of the main important factor for IVF is tubal block. When both the tubes are blocked, naturally the women cannot conceive. So she has to go for artificial methods like ICSI or IVF. It all starts it's kind of a simple vaginal infections. Like a lot of times they apply a lot of creams or like whatever gels. They self-medicate, and there's an infection. You have to properly take the course and get it treated. Otherwise, it will keep spreading in, and finally you land up in PID. It's called pelvic inflammatory disease, where she'll keep coming with a constant lower abdomen pain, sometimes alteration in your periods, where excessive bleeding, dysmenorrhea, menorrhagia, or like irregular periods, like no very scanty flow. So then constantly she'll having lower abdomen pain. Sometimes can lead to additions. Tomorrow again she's trying for pregnancy. Everything will be additions. The tube, your ovaries, everything will be added together, and which leads severe pain. Also, it also creates a lot of problem when you're trying for pregnancy. Then again, it can actually start spreading inside, and the whole abdomen also can get infected, where we have to go in, give a wash. We do a diagnostic laparoscopy, we wash it, then we do additional lysis because everything will get stuck. So once when you only release it, then the pain will be relieved. So this basic simple infection, like no, you get treated at the early stage itself, you can avoid all this. So that is actually very important. So whatever products have come, like, which you are seeing, always like, you have to consult it, just because for marketing they're selling, they'll say everything. It becomes whitened, like within 2 weeks, please apply. You cannot whiten anything. So it just like probably you can keep it lightened, but again, with your healthcare provider, you just get a proper advice. And if they say you can use it, then you can go ahead and use it. Otherwise, I would really say like, no, don't even self-medicate, and don't go by all these products.
Thank you so much, ma'am. Since infertility has come up, what are some of the basic things that we need to keep in mind to avoid infertility concerns in the future?
See, infertility, again, it's a broad topic. Since we are talking about the hygiene and infections, let us look onto it. This is apart from your hormonal imbalances, where your cycles are regular or irregular. First, you have to regularize your periods, and make sure like you don't have any thyroid early stages, get it cured. Another one of the most commonest what we see is polycystic ovarian syndrome. Again, it's because of hormonal imbalance. See, all these 80% of the treatment for all these hormonal imbalance are lifestyle modifications. It is good healthy diet, exercise, you reduce your weight. With that itself, your periods will get regularized, your hormones will get regularized, your egg will get properly released. That will still happen. Apart from that, as I said, now infection 25 to 30% is becoming a main concern now, because a lot of people who are going for ICSI or IVF, if you see the main indication would be like the tubal block. The tubal, how does it get blocked? Because of the infection. If both the tubes are blocked, then again you cannot conceive naturally. And also, as I said, the PID, when PID spreads in, everything gets stuck. Your egg, I mean your ovary, your tubes. Again, if the tube is not blocked, again, because of additions, again, the ends can get blocked. And because of that have severe pain, again, they cannot conceive. So these are the main things, like, I would say, like, no, they have to, like, immediately, like, early stages gets treated. The young generation usually, like, what I would say is, before getting married, always have one consult, like, with your gynecologist. So what all, like, I have to follow it, this includes everything. Your if your periods are not regular, you regularize your periods beforehand, before getting married. And thyroid issues, get it treated, and any infections. And also they can ask about, how do I maintain my intimate hygiene, and during sexual hygiene, what, like, how I have to go about it, like, what are the hygienes, and what are the contraceptive I can use it, which is a safe one. So all those, I think they should have kind of a pre-consult before getting married. And always get yourself treated before getting married, because again, like, no, you'll be wasting your time once you get married. So before itself, you keep yourself ready, and immediately you plan after your wedding, then it will be like it will be very smooth, like, once your, like, cycles are regular, there is no infections. And what are the main conception period, that's another commonest doubt they have, like, which is the period where I have to join, which is a main ovulation. Again, like, by textbook we always go with 14th day the ovulation occurs, but it's not the same for everyone, because the cycles are, like, varies for different people. So we have to see what is the pattern for them for the last 3 months. So according to that, then we will say these are the dates where probably your egg can get released, where you can join, where they can try naturally at home. Apart from all these, most important, everybody, what they have to follow is lifestyle modification. That is, they have a good, healthy diet, cut down all your junk foods, fatty foods, oily foods, fast foods, everything. Go with a lot of fruits, vegetables, and at least 45 minutes of active kind, some kind of exercise to balance out your hormones. So a lot of times the mother comes with a daughter, they think she's already thin. Why she has to work out? Workout is not to lose weight. It's just to balance out your hormones, because we're seeing a lot of polycystic also is very thin. Still, they're polycystic and irregular cycles. So just to balance out their hormones and to, like, keep yourself fit and healthy. Another thing is, most important thing is, you have to be stress free. Stress is another important factor, which is also a cause of raising infertility. So again, the proper sleep patterns, at least 7 to 8 hours of proper sleep has to be there, and the work schedule, because now a lot of people in the IT industry, they'll have a lot of stress, like one will be doing a day shift, another one will be the night shift, like, all the stress factors, everything is there. And especially when these women go for the night shifts, the whole day they'll be sleeping, so there is no proper diet, there's no exercise, and they're the ones who come with a lot of polycystic and hormonal imbalance and infertility. So whichever is, like, your schedule, make sure, like, you just take care of your health and lifestyle also. So these are the ones which can actually prevent them in future, where they can uh, not lead to all these kind of, like, infertility treatments. With this itself, when they try, actually naturally they get conceived.
That's excellent advice, ma'am. Thank you so much. Since we're talking about contraceptives, at what age do you think it's recommended to start using contraceptives? And apart from pills, what are the other ones we can consider?
Contraceptives, as I said, no, where when they come, I usually advise them before getting married, always have a pre-consult, and they can ask about all the doubts about what kind of contraception, because contraception, it has to suit their body. So as a doctor, like, we have to lay out all the options, like, starting with a simple, like, condom, then they can go with the oral contraceptive pills. Again, you have a lot of combinations with that. Then you have injections, where you can give monthly injections, or like once in 3 months you can give. Then you have something called implants and patches, where again it's for a month, or like, 3 months, every time you have to reinsert, and take it out and reinsert. Then you have IUD, that is intrauterine device, that is like a copper T. Then again, copper T also, we have different, like, what do we say, like, uh, the expiry, like, one is for 3 years, one is for 5 years, one is for 10 years. So you can just ask them for how many years they want it, then we can lay that options. And the other thing is intrauterine system, where it's called Merina. That is actually, copper T is where it's a non-hormonal intrauterine device, whereas Merina is a hormonal intrauterine device, where the progesterone will release inside the uterine cavity. So again, that is another option if they already have menorrhagia, excessive bleeding, then they have dysfunctional uterine bleeding, excessive bleeding. So it has two main effects where it can control the bleeding as well as it acts as a contraceptive. Again, lifespan for that is just 5 years. Every 5 years you have to change it. Then again, you have some female condoms also, diaphragm fetal condoms, but that has a high failure rates because it has to be properly used. Again, otherwise can lead to infection. Then again, like no failure in pregnancy. So these are the different commonest ones we can actually can tell them. Of all, I would say is like for the young couples, either they can go for condoms, which I would suggest them, or they can go for the pills. Again, pills they have to take it regularly. That's only concern is if they miss the pill. Again, there are chances it can get fail and they can get pregnant. So again, when they miss what all, I mean, when again they have to take it or immediately consult a doctor to see what kind of higher dosage we give. That also we should tell them. And for younger people, again, I wouldn't advise copper T IUD because that one of the most common side effects we have is a lot of infections. It will not suit them because the copper sometimes it will be very allergic to them because it's getting released in the cavity. They'll have a lot of white discharge. They'll have very lower abdomen pain and dysmenorrhea and even menorrhagia. So for the young couples, usually maybe after delivery, if they want to use it, they can use it. But again, for some, they have tried even copper tea, but it's beautifully set in because for each body how it suits. So the first two options I would tell them. And even if they use like, for example, if they're going ahead with the copper T or like, intra-uterine devices or some implants or injections. But again, to prevent infections, they have to use condoms. That's only thing because it's the only thing which will prevent you from any kind of infections or sexually transmitted infections. Because a lot of people who taking these kind of pills or have IUD, when they have vaginal infections or if they have sexually transmitted infections, I tell them, even if it's there inside, still you use a condom. Condom is just to prevent all these sexually transmitted infections. So whatever method you're using, when you have infections or you're suspecting some sexually transmitted infections, you have to go with the condoms. That is the safe one, which will prevent. The rest all will not prevent any infections. So this you can just put to them, and depending on how it suits their body, and then we can advise them because some might will have hormonal imbalance or they'll have thyroid or polycystic issues or already they had recurrent vaginal infections. When they have recurrent vaginal infections, again we don't recommend copper T or IUD. Maybe injections or tablets will be the better along with condoms.
Thank you so much, ma'am. So for oral contraceptives, what are the most common side effects that you see on a day-to-day basis?
See, one thing is first it has to suit them because as I said, like it comes with different combinations. Like the hormonal combinations are different, and the commonest what side effect they'll have is nausea, vomiting. They can have headache. They can have little bloating sensation, and they'll be weight gain, and sometimes mood swings. They get really irritated, and they really feel discomfort. When they use it, always we start with a very low dosage. We get a low dose pills we have always start with that and ask them to take it within 3 or 4 days. Whatever side effects, if it's not suiting for them, it immediately it'll show up. They'll come and complain within 2 or 3 days. Then this combination it's not working for them. In that case, you can put another combination. Even if that is not working, then you can give the other options where they can go for injections or if no other infections, then they can go for copper T or even Marina not necessarily that she has to have menorrhagia to go with it. Even if it's fine, but still you can go with hormonal IUD. That is also very safe and good, and most of the times we don't see that kind of side effects in Marina. So we can give other options, but these are the most commonest ones they'll come. And if they have any discomfort, immediately let them stop. Then we can give an alternative one. That's always there because that again in future they can lead to other side effects where they'll put excessive weight gain and all those are there. So again, you can't give it for a long period of time. Initially for 6 months you can give it or maximum 1 year. After that you just tell them to take a break and then again we'll give because sometimes when they come they last for 3 months but will continue for 3 years. So continuously taking is also not good for your body. Always we tell them to take a break.
Thank you so much, ma'am. So let's talk about hormone replacement therapy. Do you recommend it for every woman post menopause, and what warrants the use of it?
See, again, hormone replacement again depends upon what is the degree of their postmenopausal symptoms. See, most commonest symptoms what they come with the hot flushes, and because there's no estrogen, the vagina becomes very dry. Because of that, have a burning sensation and constant itching. Because of dryness, it can cause itching, and also that can lead to fungal infection because of the dryness, and constant pain and a lot of mood swings, and also when estrogen is very less, it also estrogen is the main one which will stimulate the collagen synthesis, which is actually really necessary for your vagina and the pelvic floor muscles, and to keep that area very what do I say, tight, firm, and give that strengthening. So especially post delivery, that's another commonest complaint where they'll come post delivery, where the vagina becomes very lax, loose, and dryness. And again, when you're reaching the premenopausal and menopausal, because of the aging, as well as there's no hormones, it will really aggravate, and that will cause excessive mood swings for them. They'll be always irritated because when they come, and most of the time when the husbands will come or the children will come and say, like, no, she's always very irritated. She's always shouting, for each and simple thing, she's not in a good mood. She just goes to a room, she locks herself, she doesn't talk, because all these issues they can't discuss openly with their partner. They don't tell it because they feel it's very embarrassing topic where, or a taboo where I cannot even talk. They don't even tell their own husband they're going through such issues where I'm having that, the area is always hot for me, I cannot sit. And again, recurrent urinary tract infections they get, and it will be painful urination also, or sometimes along with the aging and these hormones, they'll have stress urinary incontinence where the urine will start leaking when they sneeze or cough. So because of that itself, they avoid going out for any public functions or anything, and they can't sit for a long time, and that area also will be very dry. And then apart from this, if they already have diabetes, all these will aggravate, because diabetes commonly they can increase all these fungal infections. So when they're diabetic, known case of diabetic, we just tell them to really control their blood sugars, because whatever we treatment go for all these postmenopausal symptoms, once there's no diabetic control, and whatever we give, it's not going to work. So when they come, we just see what is the degree of their symptoms. If it's mild, moderate, or severe, how it's starting. If it's mild, then we just tell them like a simple lifestyle. Like again, we just tell them have a healthy diet, take a lot of soya, isoflavones, because all these are phytoestrogens. So that naturally in diet they can increase, and definitely they have to exercise 45 minutes at least, because if they're overweight, definitely we just tell them to reduce their weight. And with a simple we can start with the simple creams, when it's really dry and burning, we can just give them jellies, for them to numb that area. And then we can also start with estrogen creams, locally we apply. The thing is, when you're giving some kind of hormonal treatments, you have to be very, very careful, because we can't give it on the daily basis. We give it usually twice a week to just apply, and only for maybe 3 or 4 weeks. Then again we give a gap, because that has a high risk for breast cancer. So we can't give a lot of estrogen therapy also. That have to be very careful. You have to see your hormone levels also and other levels, and then uh, see how much of dosage and how frequently you give. So now, that was the only option we had. And when they come with the severe symptoms, we couldn't go further beyond with that, because max we could go for 4 weeks. Then we have to stop. Then again, if they have a family history of breast cancer, or already had any other high estrogen kind of risk factors, then we wouldn't put on these estrogen creams or estrogen tablets. Then we have something called multivitamin, which will act as estrogen, which I said like all these phytoestrogens, isoflavones, everything is there. I usually don't prefer giving much of these estrogens to the postmenopausal women, whichever degree they come. I start with all these simple diet, exercise, all these lifestyle modifications, and these kind of non-hormonal jellies, and then non-hormonal replacements I give them. Along with that, now the latest other treatments have come for all these postmenopausal symptoms, especially for the dryness, for the burning, itching, where we go for laser treatments. Initially we didn't have it, but the last 7-8 years, this new treatment modality has come, where we give laser up to full of the vaginal area. It's called vaginal rejuvenation. How we go for skin and hair rejuvenation, we give vaginal rejuvenation. Basically what it does is, it basically stimulates the collagen, because collagen, as you age, it keeps decreases, and especially for women, the estrogen is the one which stimulates the collagen. When there's no estrogen, the collagen synthesis also will come down. So the area also becomes very, what do I say, very lax and like very stretchable and gives a dead look. So we rejuvenate that area by doing this laser treatments. It basically stimulates a collagen, causes a rejuvenation, the new cell, the new layer of vaginal tissue actually forms. So when the new tissue forms, what happens? Your secretion increases, your lubrication increases, your pH is coming back to normal. So your dryness issue is cured, so that that area, whatever, like, you feel very hot, it's coming down. And the burning and itching sensation also will come down because that area is becoming moist right now. So that's one treatment we have now, which is giving a good symptomatic relief. And it not only rejuvenates, also because of the aging vagina, it gives a tightness and firmness, especially when they have stress urinary incontinence or urinary leakage. That's one of the most commonest complaint women will have post-delivery. And in post-menopausal, every fifth woman will be the commonest complaint, where the urine is leaking, either because of stress or, like, when they just walk, like, they're not able to control urinary incontinence. And sometimes even bowel incontinence also will have, because of the full, that vagina, the, like, the anterior compartment, the posterior compartment, everything is connected. So all those will become loose and lax, and that can actually lead to all these laxity and all these incontinence issue, and thereby having the recurrent urinary tract infections. So we give these lasers that also will strengthen, will cause fibrosis of those tissues along with the collagen synthesis. So it also reduces the urinary leakage when they come in the early stage, when they come with a mild to moderate urinary incontinence. If it's severe, they have to go for surgery. Surgery is a gold standard. Whereas if it's a mild early stage, because these are a first line of treatments. Initially, we didn't have any treatment for this urinary leakage. All we could say is do some pelvic floor exercise, Kegels exercise, reduce your weight and your lifestyle modification. But these new modalities come, it's giving a very good results, provided they follow all these, whatever I said right now, all these lifestyle modifications. That's one which has come. Another one is injections where we give for the vaginal dryness, especially for the postmenopausal women, where we cannot give much of hormones. So another non-hormonal treatments are these, where we give platelet-rich plasma. That's called PRP, where we take the blood, we just take the PRP and we inject into full of the vagina and also the certain spots. So again, basically it rejuvenates. It actually leads to the formation of new vaginal tissue, just like how people are going for a PRP for the hair loss and for the skin rejuvenation. It's a natural treatment. So that is also giving a very, very good symptomatic relief. So I have stopped 95%. I've stopped my practice of giving any hormones, unless otherwise it's a very, very severe form of postmenopausal symptoms. Otherwise, I go with all these lifestyle and multivitamins, non-hormonal multivitamins, which will act as a hormone, along with laser and these kind of injections which I give, and it's giving a very, very good symptomatic relief, because there's absolutely no risk factor, because all these are drug free. The PRP which you give is your natural blood. So again, 100% safe. And the laser also, it's like, we're just giving it locally, and that is also 100% like, giving a very good results, no major side effects, because, lasers are becoming very popular. A lot of phase, and for all the cosmetic procedures, left, right, and center, we're using lasers. Same thing is giving a very good results. And if it's very severe in the extreme stage, then in between temporarily, I'll just give some, put them on some creams along with these treatments. So at least the severity reduces, and this on the time period, they keep getting it done once in 3 months. It giving a very good symptomatic relief, and then can actually keep maintaining it. Because those days, we only to a certain limit we could give these hormones, as I said. After that, like, we couldn't help them, and the symptoms were becoming very severe, and it was really affecting the day-to-day life. A quality of life was getting affected. These are the intimate issues where they don't even discuss at home. They don't even talk. They silently suffer. So now, like, all these new modality of treatments have come, which is actually giving them very good results and good symptomatic relief. I think they also deserve to have a good quality of life at that age, especially 50 plus. So otherwise, a lot of people go into depression. They become very antisocial. They don't go out for any public functions. Even if they go, they just come back very early. So this is actually giving good results. And all these are very, very popular abroad, because abroad, if you see, like, it's not like in India. India, like, as I said, people don't talk about these issues. They're very, like, still they think as like a taboo or embarrassing, that people will think bad about me. But whereas abroad, like, when I was abroad, like, I've seen women even sexually active in up to 75 years, because they take care of their health. Like, whatever little issue, immediately they'll just go to their doctor, get them some treated early stage. That's the reason you don't see much of vaginal infections and cervical cancer in the Western countries, not much. Only in India we see that. Because early itself they just treat it. Even any kind of course, a lot of sexually transmitted infections are very, very high there. But still, like, early itself, like, they get it treated so that they don't let it to progress to a very later stage. And uh, I usually regularly, what I say is, for both the partners, for both men and women, your physical health, your mental health, your sexual health, all three are equally important. So I would say you have to take care of all three equally.
Thank you so much, ma'am. You shed a lot of light on a topic where information is very scarce. You very rarely see conversations about menopause and the symptoms. Thank you so much, ma'am. So, before we wrap up, I would like to address one last taboo topic: masturbation. What do you think are some of the myths about it that you want to take this opportunity to bust? Like, this is not true, this is wrong.
About masturbation, I would say it is like, it's happening, it's common, it's natural. There's nothing wrong about it, and there's it's not going to cause you any harm, as long as, like, if you feel good, you can keep doing it. Only thing is, what I would say the women, especially all those sex toys, which this generation, a lot of people, even though it's not available in India, people are getting it a lot online. You have to get a proper one. Make sure it's not very sharp, or very big, or what kind of material. Everything has to be properly seen, because again, that can lead to a lot of infections. Even while using it, make sure every time it's cleaned properly, because again, it's a personal choice. Like, even the couples are actually using multiple, just to spice up for the life, they can actually use it. But every time, make sure it's like, very clean every time, every a single time when you have an act. And after that, clean and properly keep it sterile, because again, you'll be transmitting infections. Again, sexually transmitted infections are very common. And use it only with one partner. Sometimes the same toys can be used with different partner. Again, your STDs gets increased. That's very important. And especially for women, what do I say is, like, whichever, like, toy which you're getting for masturbation, whatever it is, make sure it's very soft toy, not it's very sharp, because the intimate area is very sensitive area. It has close to 6,000 nerve endings, especially the clitoris, the urethra, and the vagina. We call it as a CUV complex, clitoro-urethro-vaginal complex. All those, that complex, which is a very sensitive area. That again, urethral complex is where the G spot is, and full that area has close to 6,000 nerve endings, which is why that area is very sensitive. And if any of the nerves gets damaged, that it can leave you a permanent, like, no kind of a nervous damage, where your sensitivity will reduce, and in future you can't even feel it. So that sensitivity issues also, we are seeing it. That's also because of the kind of the toys or the sharp instruments which are using. Because I've also had patients where they come with the vaginal tear and bleeding because of the sharp instrument. So that they have to be careful. And the right size, that is also important. Like, whichever fits your vaginal, like, that you have to use it. Because when you use a larger one, again, it can get damaged. That is also there. Another one thing, what do I say is, like, as I said, like, okay, there is no harm, you can do it, but don't become addictive. Because once you become very addictive, then in future it becomes a problem, because you're so happy with yourself with this kind of addiction where you do multiple times. Tomorrow when you actually get married, it becomes a real problem, because the same expectation you will have with your partner to do it. And more importantly, the physical touch, the intimacy, everything goes off, because you become so used to the machine. And the pleasure with that, like, machine is different, and human touch and human is different. So that's one thing I would say. Let it be even for both, like, let it be men or women. I would say is that don't become addictive, where, like, you end up being so content and happy with yourself. Like, tomorrow that causes a lot of relationship issues, and a lot of divorces also happen. And even if you see abroad, I see a lot of single women. The main reason, if you ask them, because they're so happy with themselves. They're saying, I'm so happy and content. Why do I even need a guy? Because they are so addicted, and they think even it reached that kind of a stage where they don't need any, like, other physical touch, because they get so used to the mission. So anything, like, they do it not excessively. Don't get addicted. As long as it's giving you a good time, you want to spice up your relationship, you can do it. But these are the ones I said, like, you have to really maintain. This one, you're mainly the hygiene of the toys which you're using, and then don't do it excessively, don't get used to, don't get addicted, and always be what do I say, safe, so that all these STDs you can prevent it.
Thank you so very much, ma'am. As we wrap up our meeting, I would really like to extend the heartiest of gratitude to Dr. Deepa Ganesh. Thank you so much, ma'am, for gracing us with both your presence, your knowledge, and for sharing all of this valuable information.
Thank you so much, Ma. I think this is such a taboo topic. I think I usually say like everything everybody should know about, especially this generation, because as I said, information is so much. Like even if we don't talk about it, anyway, they're going to end up knowing all the information. So at least we should lead them in the correct direction, not like go with whatever information or YouTube videos and finally land up with a lot of complications. As I said, all these infertility and other future complications which they come. So because we are nobody to tell them not to do anything. Like it's their life, it's their body, it's their choice. They can do it. But as a medical profession, what I would say is like we have to tell them what are the pros and cons, which is right, and how we have to go about it. Like these are the little, like we can just guide them. The rest, I think, when we do these as a medical practice, it's, I think a lot of things can be avoided with all these like infections or further some complications. Everything can be avoided. Rather not talking about it and we also keeping quiet, and they'll end up doing what they feel, whatever's in the internet, whatever somebody's talking is true. So I think we also have to be little open and broad minded, and we should not actually shy away from these topics, because it's just end of the day, it's a body. It's like no, it's medical. Like as I said, physical health, mental health, sexual health, all three are equally important. So I think like we have to address it all three equally for a healthy lifestyle.
Thank you so much, ma'am. I know that I learned a lot today from you, and I am sure as did all of our viewers. This has been greatly beneficial. Thank you also to all of the viewers for attending and for taking the time of your day. I would also like to take this opportunity to thank all of the IMA MSN Council members who made this happen. This program has been an absolute delight to be a part of. Thank you for giving me this opportunity, and thank you for spreading all of this knowledge. Thank you so much.
Thank you. Thank you.